So, blood pressure is an important indicator of health, and right now, in my hands, you see a tonometer, the introduction of healthy habits. Assalamu alaikum, my dear friends. My name is Dilara and I have been working in the field of healthcare for a long time, a nurse. And today I'm happy to welcome you to my channel where we will discuss important aspects of health, share useful tips and review modern medical devices that help us take care of ourselves and our loved ones. In my first installment, I want to introduce you to one of these devices, a tonometer. We will take a detailed look at its functional features, learn how to correctly measure blood pressure, and talk about how to keep it normal. Let's begin! Blood pressure is the force with which blood presses on the walls of the arteries during circulation through the body. It consists of two values: systolic upper, the pressure at the moment of heart contraction, and diastolic lower, the pressure during the period of relaxation of heart, between beats. Normal blood pressure values are usually around 120/80 mm of mercury. And right now, in my hands, you see a tonometer, a medical device designed to measure the blood pressure of a person. And now I will familiarize you in detail with how to properly use this medical device in action. Before starting the procedure, it is important to ensure a calm environment. It is recommended to refrain from drinking coffee, tea, alcohol and smoking 30 minutes before the measurement, as well as avoid physical activity and stressful situations. Sit on a straight-backed chair, leaning on it, and place your feet on the floor without crossing them. Take the tonometer cuff and wrap it around your upper arm 2-3 cm above the elbow. Make sure the cuff fits snugly around your arm but does not cause discomfort. Insert the olives of the phonendoscope into your ears and position its diaphragm in the area on the ulnar fossa where the brachial artery passes. If you cannot feel the pulse with your fingers, simply place the diaphragm of the phonendoscope in the center of the elbow crease. Proper placement of the phonendoscope will allow you to clearly hear Korotkov tones, which are the sounds produced when blood flows through a compressed artery. Make sure the valve on the tonometer's chest is closed. Start compressing the pear, pumping air into the cuff. Continue pumping until the pressure in the cuff exceeds your normal systolic pressure by 20-30 mm. This is necessary to completely compress the artery and prevent inaccurate readings. Gently open the valve on the pear, allowing air to slowly exit and cough at a rate of approximately 2/3 mm per second. Listen carefully with the phonendoscope. The first beat heard corresponds of systolic upper pressure. The last beat heard indicates diastolic lower pressure. Well, friends, today I gave you a briefing on the rules of using a tonometer, and it's time to talk about blood pressure in more detail. And we'll start with an important topic, the dangers of high blood pressure. High blood pressure or hypertension is often called the silent killer because it can be asymptomatic for a long time, causing damage to the body. Without proper control, hypertension can lead to serious complications such as cardiovascular disease, stroke, kidney damage, and vision problems. But let's break down how we can control our blood pressure. Effective blood pressure control involves several key aspects. First, measure your blood pressure regularly at home and record the results in a diary. This will help to monitor the dynamics and identify factors affecting its change. Visit your doctor for a professional assessment of your health and, if necessary, possible drug therapy. Strictly follow the doctor's recommendations of taking hypnotensive drugs without missing doses or changing the treatment regimen yourself. The introduction of healthy habits such as proper nutrition, physical activity, and avoidance of bad habits plays a key role in controlling blood pressure. So, blood pressure is an important indicator of health on which the functioning of many body systems depends. Regular monitoring of blood pressure, awareness of the possible risks associated with its elevation, and healthy lifestyle are key factors in the prevention and management of hypertension. Remember, your health is in your hands, and taking timely action can help preserve it for years to come. Thank you for being with me today. Take care of yourself and your loved ones. See you again. Bye-bye.